I'd like to introduce to you Brenda Eskenazi. She directs the Center for Environmental Research and Children's Health at the University of California at Berkeley. She is the Jennifer and Brian Maxwell Professor of Maternal and Child Health and Epidemiology and the Chair of the Division of Community Health and Human Development at the School of Public Health at UC Berkeley. She is a neuropsychologist and an epidemiologist. Her long-standing research interests have been the effects of toxicants, including leads, solvents, environmental tobacco smoke, dioxin, and pesticides on human reproduction and childhood development. She's the principal investigator and the director of the NIH EPA Center for Excellence in Children's Environmental Health, and is, I hope you're going to tell us about your Keystone Project, right?
Yes.
Yes. Okay, which investigates the exposure pathways and health effects of pesticide and other exposures in farm workers and their kids. So please welcome Dr. Eskenazi.
Thank you, Ramona.
Thank you, Brenda.
Well, I want to start out with saying that I'm one of the original directors also, and I was a brunette when we started out. And I guess I could be a brunette again, but... So this is a picture of where I do our research, and I'd like to acknowledge our core directors, Asa Bradman, Kim Harley, Nina Holland, and Mary Minkler. And I just want to say something about Mary. She actually has written the book on community-based participatory research, and that's really what we're all about. So I am going to talk about our Keystone Project, which is the Center for Health Assessment of Mothers and Children of Salinas, which is chamacos. And chamacos means kids in Mexican Spanish. And that's what we're about. We study a Mexican population, Mexican-American population. We are proud to be a community-university partnership. The Chamaco study area is about 2 hours south of my university. It's in the Salinas Valley. It is the salad bowl of the nation. Most of the salad that you're eating here in Washington, D.C. has probably come from the Salinas Valley. And on the right-hand side, your left-hand side of the map of California, you can see the pesticide applications because California is unique in the nation. Every pesticide that is applied in the fields, the time and date and location and the type of pesticide must be reported and it's enforced. And so you can see that the Central Valley, where is the very, very big agricultural area, but the Salinas Valley is unique in that it's intensive. Per unit acre, you actually have more pesticides applied than in the Central Valley. It also happens to be only 2 hours rather than 4 hours away from UC Berkeley. And one more thing, farming occurs 11 months a year. So if you want to study a migrant farm worker population, you're less likely to lose them if you go to the Salinas Valley than if you go to the Central Valley. So the history of California is that California is the 5th largest supplier of food and commodities in the world. It's also a very, very big industry, agriculture. It's a $44 billion industry. But California has a long-standing history of adversarial relations between growers and farm workers. And 91% of the over 500,000 farm workers in California come from Mexico. 56% we believe are unauthorized to work in the United States. And the Salinas Valley, where I work, has been the site of the largest farm workers' strike and many of the protests that were organized by Cesar Chavez many years ago. So we're talking about an area that has a long-standing history, besides the fact that John Steinbeck was born in Salinas and wrote about Salinas. But we decided 15 years ago to bring everyone to the table to discuss the agricultural issues in the Salinas Valley. We not only brought the farm workers and the advocates and the people that serve them, the medical providers, the legal providers, but we also brought to the table the growers. And that was a difficult decision to bring together all the different groups. In fact, my son said to me 15 years ago when he was young, he says, if Cesar Chavez couldn't solve this problem, why do you think you can? So the goals of the Chamaco study are to look at the chemical exposures to women and children living in the Salinas Valley, to look at the association of exposure with growth, fetal and child growth, including obesity, neurobehavioral development, respiratory disease, and the age of onset of puberty. As you know, the age of onset of puberty is getting younger, and that has important ramifications for health, not only health of teenagers in terms of risk-taking behavior, but also in terms of future health, such as breast cancer and prostate cancer. We also go from the bench, meaning looking at the very, very basic science, genetics and epigenetics, to the field. And that is, we also spend a lot of our time, although I must say 15 years ago, I think it was 10 years ago, I protested that we had to do so much community outreach and translation. It has turned out to be one of the most rewarding parts of our center, and something I would not do without anymore doing any of my research. So the keystone project of the Chamaco study is it's a longitudinal birth cohort, which means, like Ricky's project, we enrolled women during pregnancy. We have followed their children multiple times: birth, 6 months, 1 year, 2 years, 3.5 years, 5 years, 7 years, 9 years, every 9 months after that through puberty. And the children are 12 years, and some of them are turning 14 in February. So like Ricky, we are seeing puberty big time. We have done multiple neurobehavioral assessments on these children longitudinally, and this is an aside, we probably have the best data on acquisition of a second language, because most of these children, when we assessed them at 6 months, nobody in their household spoke anything but Spanish. And we've watched them evolve into being English speakers, and we'd love for a psychologist to get involved in the evolution of language here. But we've done incredible amount of work on looking at growth and development, as well as respiratory disease. And on the right-hand side, I can't right, my left, I have a neurobehavioral problem. You can see a 12-year-old holding up her T-shirt that we gave her when she was a newborn. And her mother, who, by the way, is a house cleaner. She's not an agricultural worker. And she said to us that because of the education that we've done with her, she now only uses green products.
Wow.
In 1999-2000, we enrolled 600 women. They were almost all Spanish-speaking, almost all born in Mexico. About half of them were in the United States for less than 5 years. We did not ask about documentation status, but we believe that about half of them were undocumented based on the laws at the time. Almost all of them were living within 200% of poverty. 6th grade education or less. If they themselves were not an agricultural worker, there was usually an agricultural worker in the household. We didn't specifically seek out farm workers. We went to clinics that served farm workers. The first group of studies that we did were our organophosphates. So one of the organophosphates that Ricky mentioned, chlorpyrifos, is still widely used in agriculture. That even though it was banned for agricultural use, it is in agriculture. There are more than 30 million pounds used per year of organophosphates. They account for about 35% of insecticides used in the United States. And we luckily can measure the metabolite in urine. So what do the metabolite levels look like of this agricultural population? So you can see on the side that the Chamacos adults compared to the NHANES population of women. NHANES is the National Health and Nutrition Examination Survey, which is the general U.S. population. And the same laboratory that analyzed our specimens also analyzed the NHANES. And you can see that the women in the Chamaco study, the pregnant women in the Chamaco study, had significantly higher levels than the general U.S. population of women of reproductive age. You can also see that the children had significantly higher levels of pesticide metabolites than the general U.S. population of children. So living in an agricultural area does increase your exposure to pesticides. We found that those levels during pregnancy were associated with shortened gestation, abnormal neonatal neurological development, decreased mental development at 2 years of age, poorer verbal abilities at 3 and 5 years of age, pervasive developmental disorders or autism-like behaviors at 2 years of age, attention problems in school age, and a dose-related decrease in IQ related to the mother's exposures during pregnancy. So those women who had high levels of exposure had their children had about a 7-point difference compared to children of women that had low levels of exposure. But we also learned that not everyone is equally susceptible. So there is something called peroxidase enzyme. I'm sorry, this is really scientific, but I'm trying to. This is an enzyme that detoxifies organophosphates. So if we have different levels of enzyme, I might be able to convert that chemical into something that's not toxic in my body, and you may be less likely to be able to do that. And that ability is coded by a particular group of genes called the PON1 genes. What we learned is that not everyone is equally susceptible. So if Greg has RR and I have QQ, well, Greg is lucky because he's got more enzyme, which means that he is more likely to make that chemical exposure something that's less toxic in his body than I am. So we know that there are differences in the Chamacos population, and we also know that it's not until children are about 7 years of age that they have adult level of enzyme, which means that the window of susceptibility that we used to think was only just around the perinatal period is really much, much greater, and that children are going to be susceptible to the effects of these chemicals a much longer period of time. So therefore, there are some people who are more susceptible, especially young children. Our research has directly contributed to public attention, and we'd like to believe has contributed to the decline in organophosphate use in agriculture. Remember, I talked about the pesticide use reporting data in California. These are actually the amounts of pesticide that are applied of different chemicals, and I want to draw your attention to the bottom curve there. That is chlorpyrifos. That is the exact chemical that was banned for home use that Ricky talked about. That's the amount that's being used over those years, those very same years it was banned in 2001 for household use. You can see that it's pretty plateaued compared to some of the other organophosphates. It continues to be widely used in agriculture. The children may not live literally in the field, but they live on the fields, and their schools are next to the fields, and they play right near the fields, and sometimes they, not supposed to, but they play on the fields. In fact, there's a documentary called The Playing Fields. You're not supposed to play on the fields. So the exposures that are happening in the fields are actually, we found it in their house dust, and we found it in the breast milk. We have examined other chemicals being evaluated by government agencies. Ricky mentioned bisphenol A used in plastics and cans and those receipts that you get. We have found that BPA exposure is related to soda and hamburger consumption, school lunch consumption, and we have found that the more acculturated a woman gets by living in the United States, the higher her levels are to BPA, because she's less likely to make that food from scratch, but to use canned and prepared food. We have found that BPA exposure is associated with thyroid hormone, which has direct implications for neurodevelopment. We have found that BPA exposure is related to anxiety, depression, and ADHD in the children. We have also studied a class of flame retardants called the PBDEs. And these are chemicals that are out of use since 2005, 2004, but they're very long-lasting chemicals in the environment and in the body. And the reason why is because they're used in furniture, vehicles, and electronics, and we don't get a new couch every year. So I don't know how many people sitting here have the same couch they had from 2004, but I bet the chairs you're sitting on have California flame retardants in it. So these chemicals are around for a long time. They have a long half-life in the body, a long half-life in the environment. They're known endocrine disruptors, and they leach out of consumer products into house dust. And California is famous for many things, but it also has the highest PBDE dust levels in the world. There are some of the other states in the United States. There are the levels in California house dust, and in my Salinas Valley, that's how high they are. And the reason why is because of that tag that you often see hanging down from your furniture in compliance with California flammability standard TB 116, 117. And the way that that was interpreted is that these chemicals were added, especially to foam, and those are the chemicals that we've studied, to prevent death and injury by fire, but we now have data to show that it doesn't save lives. So who's at greatest risk? Those kids, because it's in house dust and kids are closer to the floor, and as Linda pointed out, kids have their hands in their mouths, and so do adults. But kids have their hands in their mouths. Our findings from flame retardants, PBD levels in the mother's blood are associated with taking longer to become pregnant, infertility, changes in thyroid hormone, again related to neurodevelopment, lower birth weight babies, increasing risk for infant mortality, poorer attention at school age, poorer fine motor coordination, and also independently from the associations we saw with organophosphates, we also see that the flame retardants are related to IQ at 7 years of age. The higher the levels in the mother's blood, the lower the IQ. A small shift in a population IQ makes a big difference. So when we talk about 5 or 7 point difference, a standard deviation is about 7 points. A 5 point difference makes this difference. If there are 6 million that are so-called mentally retarded, if you shift the distribution of the IQ of the population by 5 points, you now will have 3.4 million more children who have mental retardation. That means 3.4 million children more who would need special services. Our research has directly contributed to the reassessment of California regulations. Thank you, Governor Brown. He has asked for a review of the flammability standard. He said we must find better ways to meet fire safety standards by reducing and eliminating wherever possible dangerous chemicals. This not only affects our California children, it affects children all over the country because manufacturing is done to the strongest standard. And it affects everybody all over the world for the same reason. We are now examining the potential health effects of other pesticides commonly used. Many of the fungicides that are very widely used in the Salinas Valley contain manganese. Manganese at low doses is an essential nutrient. At higher doses, it's a neurotoxicant. We've looked at the very controversial methyl bromide, which has been considered to be essential for the growing of strawberries in the Salinas Valley, and there's been a special dispensation for its use in that regard. We have shown the relationship with lowered birth weight in the community. We also are looking at pyrethroids, which have replaced chlorpyrifos for indoor use. They're widely used, and we know virtually nothing about their safety for children. Our belief is it's important to protect our children, and in name of the precautionary principle. We need to prevent exposure, so we educate all different constituents of the community. We have a whole program that you can look at our website to educate child care providers. We have a youth community council where we have brought farm worker children from the community who have never seen or thought about going to college. One of them is now at UC Berkely, that we got to be interested in science, and she says she's going to major in public health. These are children whose parents never went to beyond 6th grade who are now going on to college and very interested in protecting the environment. We educate clinicians and social service providers and policymakers, not just those in the room, but also in our state, and parents and families. We had over 500 people at our community forum last December, where we had farm workers raising their hand and asking about the health effects of flame retardants and how they could protect themselves. We have educated children with puppet shows, and the children have taught their parents not to hug them when they come home from the fields because they might be exposed to pesticide residues on their clothing. We believe it's important to educate all the constituents in the community to effect a change. We have so much more to do. We have 80,000 chemicals, and only a few have been studied to determine the potential effects on children's health. We're poised to be able to do that in the Chamaco study because of the funding to provide a longitudinal data set that allowed us to collect over 150,000 specimens over the course of pregnancy and childhood in a large biorepository. Those are our freezers. And it would be important to follow the Chamaco's children to adulthood. They're 14, they're poised to become adults, they're semi-adults as I call them. Salinas is notorious because it has one of the highest per capita rates of gang violence. We can't drive a red car or a blue car into the town of Salinas. It's got one of the highest homicide rates. My office is bordering on the jail. Teenage pregnancy, very high, and high school dropout, very high. We know from studies on lead that exposures to neurotoxicant can contribute to these psychosocial endpoints. The question is, are some of the others, like organophosphates and PBDEs, also going to contribute to these types of endpoints? And we need to be able to follow these children, with the help of our funders, 5 more years. We want to thank all of our families. It's not easy for these families who work really, really hard to be dedicated to continue following in our study. And we want to say that everything we've accomplished was thanks to U.S. governmental funding, so I want to thank everybody here for anything you've done to make that possible. But now we need to leverage what you have helped us to build to protect future generations and to protect these children. And as Ramona has said twice, children are 1/3 of our population and all of our future. I do want to say that, like Ricky said, the budgetary problems, the government shutdown, the sequestration, have had not only effects on our research, but effects on the psyche of my students. I'm a chairman of a department, and I can tell you that my students are now saying to me, I don't want to go through what you're going through. I don't want to know that I won't have a job. We are seeing students leave science. We are seeing students not wanting to become scientists. The effects of these kinds of temporary breakdowns in the U.S. government have really grave ramifications for our future scientists. And I just wanted to hope that we don't see this again, and that you continue to fund these children's centers. Thank you.
We'll take 1 or 2 questions, and then we have to get to Dr. Viet. So any other questions for Dr. Eskenazi?
Like Ricky said, just one question. Just so I know you're listening.
So what would you say the biggest intervention is that you've made to help improve the lives of the children in this community?
I think that the biggest intervention we made is by engaging the children. That one of the fathers at a farm worker forum, it's not probably what you expected me to say, but one of the fathers at the farm worker forum, a farm worker himself, said, by you studying this community, you have shown the value of education to our children, and scientific education. And so it's not just about the interventions we've done, because, for example, the strawberry growers are now using gloves to pick strawberries to protect the farm workers so that they don't get pesticide residues on their hands and in their bodies, because we showed that gloves work. They won't tell us that it's because of us, but we know it's because of us, that we've made a difference in there. I think it's also that we care about a community that not many people care about.
Well, we certainly appreciate your work. Thank you so much.